welcome to the NewsX Sunday Guardian Roundtable. Today we are looking at a very important issue. In fact, we've been seeing the increasing number of heart attacks or health issues leading to sudden death in people who are quite young. Heart attacks is something we associate with a much older group, but people in the age group of say the late 20s, early 30s to the 50s have also of late been suffering from heart attacks. Is it something because of the lifestyles we lead, the stress, the tension? Some people are attributing it to the post-COVID vaccine complications, or is it something else? That and other lifestyle issues that we've seen that in the earlier days, whatever the deal was, there was some kind of the stress or the these kind of incidents of health was not so much. So how cautious should today's youth be? How much should we do our executive checkups, for instance? What are the tips and preventives that one should go in for? I have to answer these questions a very panel of highly experienced doctors. Joining me on the show is Dr. Romel Tikku. He's the Director Internal Medicine at Max Healthcare. Dr. Harsh Mahajan, I mean, he's the one person who knows exactly what's going on in town. Everybody goes to him. He's the founder and chairman at Mahajan Imaging, and he's also the chief radiologist. I have Dr. Pradeep Katra. He is an MD in internal medicine and also runs his own hypertension clinic. And Dr. P.S. Venkateshwar Rao. He is a endocrine, breast, and laparoscopic surgeon. He's a consultant in Bangalore. Dr. Tikku, tell us what is happening on ground and how serious are these issues? Are these cases of heart attacks? But heart attacks are usually, they lead up, something leads to a heart attack. So what should we be worried about and look out for?
Well, there has been an increase in heart issues, and it's a concerning global trend all over, not only in India, all over the world.
Okay.
And there are multiple factors for it: traditional risk factors, lifestyle changes, stress, etc. If we talk about lifestyle, then poor eating, faulty habits, too much of saturated fat, too much of sugar, sugary drinks, junk food, lack of fiber in diet, physical inactivity, sedentary lifestyle, not going for a walk,
Mhm.
obesity, overweight, being overweight, your BMI more than 25, and too much of indulgence in alcohol, smoking, vaping, hookah. It's become a trend now. And then you talk about stress, anxiety, depression, leads to binge eating, lots of other issues, insomnia. These all can trigger heart events. And also the fact that you have a lot of stress these days of job insecurity, work pressure, family demands, and things like that. And then the health issues, undiagnosed health issues or uncontrolled health issues. You might be a diabetic for all you don't even know you have it, uncontrolled sugar, uncontrolled blood pressure. It doesn't give you any symptoms. Very high cholesterol, LDL levels, polycystic ovaries, insulin resistance. There are so many factors. And see, Indians are again genetically predisposed to health issues, South Asians for that matter. And if you have a family history of heart disease, and then the lifestyle also, substance abuse, lots of parties where you consume cocaine and things like that, they can trigger heart issues. And now people, young generation, which goes to the gym, has this habit of taking too many fat burners,
Yeah.
supplements without medical supervision, anabolic steroids. I mean, everything can lead to heart events. It's not one size fits all. And again, if we talk about COVID and COVID vaccines, um, if you ask me, COVID vaccines have actually prevented heart issues because they've prevented COVID in so many crores of people in our country. But if you talk about COVID, it predisposes you. It's a hypercoagulable state. It can lead to stroke, myocardial infarction, deep vein thrombosis, pulmonary embolism, and the likes, myocarditis, heart issues, and a lot of inflammation. You've seen up to even, there are studies which say up to even 1 year, you can have heart issues post COVID and then long COVID. And I would say it's a host of issues, everything put together. We always say that COVID vaccine or a particular thing is, but each person is different. We have to go by the history, their lifestyle choices. There's so many factors to it.
Now, Mahajan, you're also on the board of a lot of, policy and government think tanks. I want you to specifically address the COVID vaccine issue. Dr. Tikku has talked about it, and other reasons that you feel is leading to these sudden deaths in one so young.
Priya, I think Dr. Tikku has put things in absolutely the correct perspective. Heart disease is due to multiple factors. We've known it for years, And, that is something that is being reiterated. Lifestyle choices, of course, genetics plays a role. And on top of that is this disease, that terrible disease that we encountered. And, as Dr. Quatra was just telling, and we know that ICMR did a study in our country, and ICMR is a highly respected research institution, and they could not see any cause and effect relationship specifically with COVID vaccines given in our country and increase incidence of heart disease. Having said that, there is a 2022 study which was published in and where 46 studies were included, which looked at the incidence of heart disease, risk factors, short-term course, and long-term outcomes. And this was done from a group in Canada, where they looked at the mRNA vaccines, the Pfizer vaccine and the Moderna vaccine, which were given predominantly in the western part of the world, the US and Canada. And there they did find that there was increased incidence of heart disease in those who got mRNA vaccines, especially the young and adolescents, the young adults and in adolescents. However, we have not seen that kind of thing with the different category of vaccines that we obtained here. Now, as Dr. Tiku said, heart disease is increasing. It is multifactorial. And only this week, we have an article in JAMA Open Network. This is the Journal of the American Medical Association, where again, this is published from Karolinska Institute, a highly respected organization from Sweden, where they find that on MRI, something which I do, and we did a lot during COVID and post-COVID in our country, they found that there were left heart issues. Left heart is where the pumping actually happens. Dysfunction of the left side of the heart, the left ventricle, as well as microvascular changes, meaning that blood supply to the muscle of the heart itself did get compromised with COVID, not with COVID vaccine. And this is a double-blind kind of study that they did, published only this week. So COVID did cause and continues to cause changes in the heart, which can lead to increased heart disease, increased heart attacks. Whereas the ICMR study done in our country about vaccines shows that there is no increased incidence. Of course, any vaccine, and so many vaccines children receive on a regular basis, we've received them. There is that, minuscule minority who may get a side effect. But as far as heart disease goes, the mRNA vaccines shown to be some increase, that too very minor, but some increase, but not the vaccines that we received.
Okay, that's at least reassuring. Dr. Katra, you also were telling us about the study, ICMR study, but the impact of COVID early on, we were thinking is more on the lungs, but now there has been some impact on the heart also. That's what it seems to be. Your reaction to that and the reasons why the increase. What do you feel why the heart attacks increasing in the young?
No, on the whole, means heart attack in Indian population, we otherwise also get coronary artery disease 10 years earlier as compared to Caucasian or other population. So first, we are more prone to both diabetes and coronary artery disease, and we get early. And so the complications are, and in most of the cases, in sudden cardiac death, in 60 to 70% cause is underlying coronary artery disease. Only in 20 to 30% patients, we are not able to diagnose or establish a real cause for heart attack. Or sudden cardiac death, it happens all of a sudden, and within 1 hour of your symptoms, patient collapses. And the mortality rate, even in hospital, in ICU, the survival rate is only 25%. And if outside hospital, if the patient does not get any support within 5 minutes, the mortality is more than 90%, is 90%. So that is where lies the problem. So sudden cardiac death has to be taken, means where if it happens outside the hospital, you have to receive that help within 5 minutes. Otherwise, you lose the life. But regarding COVID, we all know COVID is a hypercoagulable state where, as Dr. Tiku has already explained, patient has more coagulation tendency. Thrombotics episodes, they increase. And this we have seen in COVID stage 1, stage different stages of COVID. So in hypercoagulable state, thrombotic episodes do happen, whether in the form of coronary's involvement or brain involvement. So that is why during COVID infection, the episodes were high. But with vaccines, as Dr. Mahajan has already explained, this ICMR survey done with AIMS, even they collaborated their autopsy findings with 5 years early with the same age group, and they could not find the vaccine involvement in this episode, in these episodes. So that is proven that vaccine has no role.
Thank you for explaining that. Dr. Rao, you also wrote a very interesting column in the Sunday Guardian about the impact on, healthy, when the time we should be the healthiest, we are not, the increase in heart attacks in the young. Is it because of our lifestyle? Apart from COVID, what are the other reasons? We've discussed COVID.
Yes, I would add another bit on the COVID issue because if you remember during when the COVID pandemic occurred, I had predicted it in 2020 January itself, and I was doing a lot of investigation into all the scientific evidence about the origins of COVID and later about the vaccines, and all these were published in the Sunday Guardian. And what I found in the scientifically published data by the Chinese themselves and by the Americans who were involved in it was extensive evidence, published evidence of collecting bat viruses, trying to do gain of function research, trying to improve the ability of that virus. They had chosen the SARS virus for all this research. Among all the other viruses they had collected. And they were emphasizing on how to spread it fast and how to cause maximum damage. That is the immune damage. And this is where why the SARS, the present COVID-19 virus, has caused far more damage than the original SARS virus. If you remember, there was 20 years ago, we had a SARS epidemic also.
Right. Okay, now I'm going to come back to you on the other issue. We need to take a quick break, but we'll come back on the other lifestyle changes that could impact the heart. But I'm going to take a quick break, so stay with us. Hello and welcome to the NewsX Sunday Guardian Roundtable. We are taking a look at the lifestyle of the young. Is it not so healthy as it was earlier? And if so, what are the reasons for it? Dr. Tiku, one is also you talked about it for the COVID before the break. Now, obesity is becoming a big buzzword. People are becoming aware of it. And I know this is a slightly out of syllabus question, but we are also seeing these new weight loss drugs that are coming in. Will they impact the heart? People are saying they will actually help the heart because less obese you are, the better it is for overall health. So what should one look out for?
See, Priya, obesity has become an epidemic all over the world, even in young people, teenagers also. So it's basically a chronic imbalance between energy expenditure and calorie intake. And if we go by definition, then BMI of more than 30 is obesity, 25 to 30 is overweight. And if you're more than 40 BMI, then you're morbidly obese. You're at a very high risk for cardiac events and things like that. But it's not only about BMI. I would say you might have a normal BMI, but if you have visceral fat, abdominal obesity, then you are at an increased risk of insulin resistance, diabetes, heart disease, cholesterol, and things like that. So it puts you at a higher risk. So we have to really manage obesity, and it's all about, it's not only the lifestyle. Yes, of course, if you have a bad lifestyle, faulty eating habits, physical inactivity, as we spoke about that earlier, and also there are genes to be blamed. There are medical issues, hypothyroidism, Cushing syndrome, and genetic, it runs into families, then drugs. Many diabetics who are on insulin or many medicines do increase your weight. uh, Sleep deprivation. If you sleep for less than 7 hours, you tend to eat more, you will gain weight. Now, how do you deal with it? Apart from lifestyle choices, you have to, if you talk about these drugs which you're talking about, it's a boon for many people actually who have failed in spite of lifestyle interventions to reduce their weight. And if they have a comorbidity like uncontrolled diabetes or uncontrolled blood pressure or heart disease, then this drug really helps. I have started the drugs which have come up in India in April onwards, and many of my patients who could never lose weight had uncontrolled sugar, and trust me, they've lost 15 to 20 kgs in 3 4 months.
But
And
is it healthy?
sorry,
Is it a healthy way to lose weight? Because,
I
we
mean,
are hearing.
it is not a healthy way. It's not meant for people if your BMI is normal, if you don't have a comorbidity which is uncontrolled. It's not for everybody. So it has to be given for the right indication. See, all my patients, where I used it, they were all obese. Most of them were diabetics. They had done everything. For years, they've been trying diets. They couldn't lose weight. Their sugars were affecting their kidney. Their day-to-day life was getting affected. It's not that we have to give it to every other person who wants to look good. It's not about that. So these drugs are meant for a specific population, and they do help a lot in reducing weight and comorbidities. But having said that, we should always try the lifestyle interventions first, because see, lifestyle intervention, even if you change your daily habits, then there are chances that you can prevent 80% of these chronic diseases. And it's not always your genetics or luck. It's about how you live. If your lifestyle is good, I'm sure you can live a healthy life. And because we
Okay.
have this habit of eating too much outside, eating faulty food, and too much of alcohol, smoking, stressful lives, we don't go for a walk, we don't do any yoga, meditation, and things like that. Sleep deprived. Most of the people are up till late in the night, especially students, and those faulty habits, too much of alcohol, smoking. So I think if we take control of your lifestyle, you might not need these medicines. But having said that, these medicines are a boon for a lot of people who actually are obese, morbidly obese, and have a lot of uncontrolled comorbidities.
But Dr. Majan, you must be hearing this debate, and I've heard it most dinner parties, and you are one person who goes out very often. Also, is the debate between people who are for these drugs and the nutritionists, and the fitness industry. Those people are pushing back. So, where do you stand on this?
Priya, if we talk of science and data and
Uh,
evidence, then there's overwhelming evidence that given for the right indication, these drugs are a boon. Of course, if you see, now it has become a trend across the world and more people are using it. It is helping, but what are going to be the long-term effects of it will
yeah,
be determined over time. That's number one. Number two, how long are these drugs you will need to take for a lifetime? Because they've seen that when you stop taking the drug, then your fat comes back
correct.
with a kind of vengeance. So it does have a yo-yo effect. Now, there is no doubt that the obese losing weight with these drugs, and also with that, diabetes comes under control. People who had uncontrolled diabetes, it comes under control. The second large, huge epidemic we are seeing in our country is of fatty liver disease. This somehow has stayed under the surface.
Good
And
one.
now we are seeing more and more people come with chronic liver disease
Mm,
because they had fatty liver. And this is in those who've never taken alcohol, who've never smoked, who also, lived a reasonably balanced life. So, fatty liver disease is another thing which hopefully, with these drugs, liver fat will also get affected. The third thing, and I was speaking with some of the bariatric surgeons who do surgery for the morbidly obese. There they say that they are seeing that people who took these drugs and then maybe discontinued them, they have seen the benefit of losing weight, 20 kilos, 30 kilos over a short period of time. And when they stop the drug and it comes back, these people are more motivated to come in for surgery. This may be a very, something which bariatric surgeons hope for, that their workload will not go down, but that's also there. So these are still early days, and but there is no doubt science tells us that these are useful. In long term, we'll determine. Having said this, I think all this debate is very, very useful for creating awareness and education of the masses, society as a whole, that you need to take control of your health. And if there is any risk factor, you need to go for preventive health checks,
Ah,
which also now include a CT angiography of the heart, a stress echo or a stress thallium, a treadmill test, at the very least an ECG, and also get your blood pressure checked. That's so simple. And you'll find people in their 40s and 50s who've never had a blood pressure checked. Check your blood glucose level at 15, 16 for children, and you can pick up, juvenile diabetes early. And so there's so much that discussions like these on programs like yours are going to help in creating awareness and education, and also in picking up disease early, because we've read throughout in school, prevention is better than cure. There is no
yes.
doubt about it. And also, I would add, prevention is cheaper than cure, because once you get a disease, then you are stuck for life.
Fair enough. All good points. Dr. Katra, one, any more tips on prevention? And, we've talked about fatty liver, diabetes, since you're also dealing with a lot of these cases. What are the other lifestyle diseases that you're seeing which were not there in the 30s and 40s?
No, these are all now, whatever we see, it is
Hmm.
related to obesity. And with obesity comes diabetes, hypertension, and we don't call it fatty liver disease these days. It is metabolic dysfunctional liver, because liver is the culprit for insulin resistance. So we have to understand now visceral obesity and especially the fatty liver, what we used to call, now we call that as a metabolic dysfunctional liver. And that is the cause of insulin resistance and cause of diabetes. So visceral obesity is the hallmark in Asians. So we have to, whatever we take, whether we take weight losing pills or injections, we have to take care of our health part first. And weight is very important. BMI is definitely very important. We have to see our waist circumference, because weight is not the only thing. We have to check our waist circumference also. That is very important, because our fat is only in the tummy.
Hmm.
So that is very important part. And risk factor has already been explained by Dr. Tiku. Whatever means our lifestyle is changing. We are dependent on restaurant food, junk food, which adds to the calories, and daily stress life, late eating, stressful life, less of sleep. All these contribute to obesity. And this has been proven that late night dinners, they lead to obesity. So we have to, means whatever we do, we have to make sure that we are eating at the right time, right food, and right exercise also.
And that even with these drugs, you have to continue. Otherwise, it might lead
Definitely,
to.
we know that. We lose weight so long we are continue with these medicines. And once we stop this, we are likely to gain weight back.
So a lot of people take these medicines as a weight management. कि अभी मैं ले लेती हूँ, I'll get to my ideal weight, then I will stop the medicines.
Yes,
Does that
that
work?
can be done if the person is very conscious, following proper diet, following regular exercise, and if he or she can regulate his lifestyle, definitely you can control weight later life, and you can stop the medicine also.
Now we know why all the fitness clinics in the industry is a little worried. But doctor, our last word, quick last word to you. Anything that you want to add, and also how often do you think people should take these executive checkups that Dr. Mahajan also spoke about?
Checkups should start even in the school
14, 15.
age. See,
Okay.
if you have a congenital heart disease, that is, you're born with the electric problem, this will lead to what we call as arrhythmias. That means the heart is not functioning in a rhythmic fashion. And then you can have a sudden death. Now, the statistic shows, and I've mentioned it in my articles, that below the age of 30, 35, often a sudden heart attack is to do with arrhythmias. Arrhythmias can even occur with drugs, with alcohol, tobacco, and various other stuff that youngsters are taking. It can also happen in a blunt injury, like there have been football stars who have suddenly collapsed on the field uh, because of a blunt injury to their chest. So these things can cause. And this is why in my article I had emphasized that it is important for the average human being, adult, to know how to give a CPR. I feel that
Yes.
if I don't know, I don't know the autopsy report of Shafali's thing, but if it was an arrhythmia, if her husband Parag knew how to do a CPR, we don't know. She may have recovered if it was arrhythmia. And even in myocardial infarction, which is we call as heart attack, things can help. And this is why I emphasize that in schools, colleges, all employers should make teaching of CPR, of Heimlich's maneuver, which is involved with choking and sudden death, of
Mm.
anaphylactic reactions like the Sanjay Kapoor bee sting leading to a sudden heart attack. There you have now
But
epinephrine
was it a bee
added.
sting? And how can a bee sting lead to a heart attack?
It can if it is a massive anaphylactic reaction. I would have been dead 55 years ago if I hadn't been given an epinephrine injection after a sudden anaphylactic reaction to horse serum tetanus vaccine, which was given in Wellington Hospital. I was in Delhi that time. I
Okay.
was rushed from school because of an injury in the school, and the doctor there gave a what is called as a passive horse serum reaction, and
Mm.
next thing my heart had stopped and I was out, and it was an epinephrine injection which got me back. So,
Okay.
these are various things that I have listed in that. These are all, if the average person knows, and nowadays epinephrine loaded syringes are available for emergency use. So, if the average, see, you may not, it may be too late by the time you get a doctor or you take this person there. So, these things are important. Now, as far as the various
Okay.
methods that have been already discussed, I don't want to
Mm.
repeat it. See, again, I love history because there are lessons to be learned from history. Otherwise, you keep repeating the mistakes. Now, if you see the statistics, medical statistics of, say, 50 years ago, you will find, and even if you see the black and white movies of beach scenes and party scenes 50 years ago, you will find everyone lean, hardly anyone who is obese. So,
Mm.
you can't now blame the genes. Your genes haven't changed. What has changed is your lifestyle, what you are eating, and a consistency in following healthy lifestyle. You can't
Okay.
just take drugs today and tomorrow you go partying. Sorry, that is not
Mm.
possible. This is why my article is titled Preventing Premature Death by Sustained Comprehensive Effort. You can't
Okay.
cherry pick. You can't say, okay, I will do this, but I will also do something else. Sorry, that's not
Okay.
possible. You
I
mentioned
think that
uh,
is something
you
we all
mentioned
agree
about
on. Yeah.
Shukla's death. Now, Shukla may have been doing
Which
physical
Shukla?
fitness. Um,
Siddharth Shukla. His name.
Siddharth
this
Shukla.
thing,
Sorry.
Siddharth Shukla. Now,
Mm.
Siddharth Shukla was a chain smoker. Now, you can't be taking anabolic steroids, doing physical exercise, and looking macro, but your vital organs are affected.
In a
And
mess.
this is why I also discussed about biological age. See, we are always talking about young people by their chronological age, but there is something called biological age. And your biological age may be very different from your chronological age. So
Okay.
if you're living a very healthy lifestyle, and like has already been mentioned about fat around the waist, fat around the waist is not underneath the skin, it is around your viscera, and it's called brown fat because there is more iron in it. It looks a slightly different color. Now that is a dangerous fat. And that is what leads to all this fatty liver, insulin resistance, and all that have other panelists have discussed. So
Okay.
this is where we need to focus. And more than BMI, the hip waist ratio is often more
Waist hip
important.
ratio, sir.
But consistency is required, and we need to
Consistent.
follow all
Okay, we
methods.
are out of time, so I'll get you back on a more thing. But I think what everybody is agreeing on is a consistent, healthy lifestyle
Yes.
rather than any shortcuts in that sense. But there are people who are obese who need medical intervention. That is also something that we cannot ignore. So on that note, thank you so much for this conversation. Thank you.
Thank you.
Thank you very much.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.